I'm Jimmy Miner, Senior Director of Strategic Partnerships at Brightree, and we've been hearing from providers on how ePrescribe has been impacting the way that they're able to function during this pandemic. I'm here today with Nick Knowlton, our VP of Strategic Initiatives, to discuss some of that feedback. So Nick, why would providers want to focus on ePrescribe in today's environment?
Well, thank you, Jimmy. Very thoughtful question. As part of our overarching COVID response priorities, we have been interviewing dozens and even hundreds of customers across our base to find out what is important to them. We are repeatedly hearing that it is increasingly difficult to obtain documentation that qualifies a given order for reimbursement from referral sources. Now, this has always been a problem in our industry. It's always been a difficulty for the HME providers to chase down physicians and get the proper documentation, get the right information on the patient to both care for them and ensure that the equipment is reimbursable. But in the COVID pandemic world, we're now hearing that our providers are not being allowed into hospitals to chase down the physicians. Physicians are increasingly working from home and conducting things through more telehealth style interaction with the patient. So it's just become a lot harder for HME providers out there to obtain the right documentation to know that they're going to get reimbursed for their equipment.
Great. What would you say is the business impact of ePrescribe for providers?
Well, Jimmy, I think the impact for ePrescribe for HME providers can't be overstated, especially in this pandemic world. When we look at the different type of metrics that are important to HMEs to be able to keep their doors open and continue to care for their patients, it is increasingly important that they have better visibility into which orders still have documentation outstanding. It is increasingly important for them to have bidirectional cloud-based solutions to communicate with their referring providers to obtain the necessary documentation. And ePrescribe solves for these problems. The cool thing is it doesn't matter where the physicians or where the HMEs are in physical space. They can still interact, they can still care for their patients that are under their joint care, and they can still complete documentation workflows necessary to keep their doors open.
And what kind of responses are you hearing from providers that have ePrescribe solutions enabled?
Thank you, Jimmy. First and foremost, we're hearing from HME providers that ePrescribe has a vast and positive impact on their financial metrics, such as days sales outstanding. Secondly, we're hearing from HME providers that it improves the speed with which they can address the patient's need. And after all, that's why we're in healthcare to begin with. And last but certainly not least, this is an often overlooked metric. Referring providers actually prefer living in an ePrescribe-based world than in the old paper-based world. They don't like being chased down for stacks of paper to be signed any more than HMEs like doing it.
Thanks, Nick. Thank you for that insight. And thank you all for joining us. If you have any of these challenges, feel free to reach out to us at info@brightree.com to find out how we can help.